Hi, this video is the RF hair transplant restoration surgery on a Caucasian man who flew all the way up from Canada, Alberta, Canada, for me to restore his hair. He'd been looking to hair restoration for years, but the main thing that he opted for my work is how natural the hairline is of my work, and I focus heavily on the hairline because when you had a surgery, especially hair, and this is your face in front, so you don't want no detectability, you don't want no plugs, or you don't want to have the hairline really high and still have a giant forehead, or you don't want too low either. My goal has always been, if you have no hair loss, what is the highest and most natural hairline that you should have, and that fits your face. And that's when you approach from that, and when you build the hairline, you build it according to the facial structure, and it is an art form, and it has a lot of meticulous detail. It requires a lot of the artistic and aesthetic detail to ensure a very natural result. On average, from the mid-eyebrow to the hairline, for Caucasian is around 7.5 to 8.5. For Asian and Black, around 6.5 to 7. Again, we use the average ethnic hairline as a guide, but really when you build the hairline, you build it according to the facial structure. So each individual has his or her own unique hairline, and it's a custom work. And as long it's overall proportional, from the mid-eyebrow to the hairline is a third, from the mid-glabella to the tip of the nose a third, tip of the nose to bottom just a third. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. So this patient will have quite a bit of narrow face, so it's arched back. No hairline straight, so we zigzag through. And then when you talk about hairline, we have two types of hairline. You can have a soft hairline or a very nice and sharp, tight hairline. So the soft hairline has a nice, bigger zigzag. And the more zigzag you have, the bigger zigzag of amplitude. You use a lot more root to go single hair. But some not everyone want that type of hairline. So some people like a more sharp hairline and more tighter hairline, and it's still gonna look natural. It's not gonna look abnormal. So the tighter and softer, the tighter and sharp hairline, they're gonna be smaller in amplitude. And but we still gonna use a lot of root to go single hair in the front, but it's a little bit less. And then after that, gonna be root to 2 hair, 3 hair, 4 hair, or we can do somewhere in between. I always try to cater the hairline according to the individual. And then once we get the shape down, we will transplant at 35, 45 in front, increasing when you go backward, and changes when you go different direction. Selection of hair grafts is important. We transplant rows and rows single hair graft in the front, followed by root to 2 hair, 3 hair, 4 hair in the back for bulk and volume. The goal on the front is softness and naturalness, and that's why we transplant root to go single hair. The goal on the back is volume and density, and that's why we transplant larger roots. But we dense pack them. This client, again, we're going to be using the FUE method. Now FUE, there are two types, FUE versus strip. It's like pulling the hair one at a time. Leave you tiny dots of scar in the back, and very small dots, and allow you to shave your hair shorter without much detectability. The strip method is the older method, is cutting the strip of skin with hair and close you down and suture you up, result into a linear scar. The strip method had its benefit and its downfall too. So there's always pro and con for both. But the FUE is the more advanced and least invasive of the two. Less painful, less bleeding, less chance of infection, no scalp tightness. But the downside of the FUE, or con of it, is it costs more because it's more labor intensive, and the number of grafts we can do is less. And that's why the FUE is good for like mild to moderate hair loss. Like this client's has 3 or 4 hair loss. We can do like 2,500 grafts in the front that he's done. The maximum I set around 2,500. Although there are days I can go beyond 2,500. There are days the highest I've ever done is 38. And again, it's not everybody can be like that. So average, I always set at 25 max. And then the other downside is I have to shave you more significant when I do the surgery. Versus the strip method. The strip method has the downside, it's more invasive of the linear scar and more painful during recovery. But again, it's not that painful compared to the FUEs. However, the best part of the strip method is cheaper. You can move a large number of hair per day. And I do both FUE and the strip method. Client with advanced hair loss, class 5 or 6, need to do like 10,000 hair, But the maximum the strip I normally harvest per day is around 5 to 6,000 a day. And then a year later, if you're perfectionist, then we can fill in. But a lot of time with 5,000 grafts, you fill in from the frontal, that it looks good enough, you might not need a second procedure. And those, again, the strip are better for advanced hair loss. We can move more hair per day and it's cheaper. Where the FUE is more for mild to moderate hair. But FUE can be used for advanced hair loss, it's just gonna need multiple sessions, that's all. So this is the art of hair transplant restoration surgery on a client with a advanced hair loss of a mostly frontal, a horseshoe hair loss pattern actually. And yeah, frontal fallout, we're gonna build all around here and then reinforce the front. I can imagine the whole front is gone, so we built the whole frontal area. Thank you.